Fibromyalgia is a chronic rheumatic disease that affects the musculoskeletal system and is characterized by intense and chronic pain that affects the muscles, ligaments, and tendons, as well as other clinical manifestations affecting various organs and systems. Due to the pain and constant sense of oppression that those suffering from this pathology must endure, fibromyalgia is also often referred to as Atlas syndrome, a clear reference to the name of the Titan of Greek mythology, condemned by Zeus to support the entire celestial vault on his shoulders for eternity. Fibromyalgia is a condition that affects a significant percentage of the world's population, generally estimated at around 2–3%, with a higher incidence in women, where it is 7 to 9 times more frequent than in men. Fibromyalgia syndrome can appear at any age, including children and the elderly, but generally manifests itself between the ages of 25 and 55, with important repercussions on work, family life, and social relationships. Pain. One of the first characteristic symptoms of fibromyalgia is the onset of musculoskeletal pain, spread throughout the body or in some specific areas, called tender points. These are a series of specific points on the body that are particularly sensitive to touch in people with fibromyalgia, as they become painful following light pressure. 18 tender points were identified, divided into 9 pairs of symmetrical points on both sides of the body, distributed as follows: 2 on the front of the neck above the clavicle and 2 on the upper chest just below the clavicle, 2 at the base of the skull at the level of the cerebellum, and 4 at the upper part of the back at the level of the trapezius, 2 on the external part of the forearm approximately 2 centimeters below the elbow, 2 in the upper part of the glutes, 2 in the upper part of the hip above the buttocks, and 2 at the knee level. In healthy subjects, palpation of these tender points does not cause pain, while in fibromyalgia patients, they are painful. If at least 11 tender points out of 18 are particularly sensitive to pain when light pressure is applied, this is an important sign for a diagnosis of fibromyalgia, but which still requires a broader and more in-depth evaluation of the symptoms. In fibromyalgia, trigger points can also be identified. That is, extremely painful points, generally located within the muscle, which can be recognized during thorough palpation due to their sensation of viscosity and hardness under the skin. Trigger points resemble the functioning of a gun trigger. As if stimulated, they are able to snap immediately and cause intense pain, thus limiting movement and making it difficult to carry out daily activities. In fibromyalgia, the pain can therefore vary from mild to severe and from acute and short to chronic and long-lasting. At the basis, there appear to be alterations in the pathophysiological mechanisms that regulate pain and in sensory processing by the central nervous system. Chronic fatigue. Another typical symptom of fibromyalgia is asthenia, a clinical condition characterized by a state of general weakness due to reduction or loss of muscle strength. It presents itself with a variable intensity that oscillates from a feeling of slight tiredness to a total exhaustion of strength. Patients suffering from fibromyalgia may experience physical, emotional, and cognitive fatigue, which manifests itself, for example, in a lack of energy or motivation, or in difficulty thinking or concentrating. Fatigue and pain that tend to worsen after prolonged periods of inactivity, for example, in the morning as soon as you wake up, or following physical effort even of low intensity. Not only that, unlike what happens in healthy individuals, in people with fibromyalgia, the feeling of tiredness does not go away with rest and ends up interfering with daily activities. Although fatigue is a frequent disorder among fibromyalgia patients, it has not received as much medical attention as pain for a variety of reasons. Among these, we find the absence of guidelines capable of precisely evaluating the degree of fatigue and the lack of effective treatment strategies. Sleep disorders. In fibromyalgia, Sleep disorders are extremely widespread, so much so that over 75% of patients reported having experienced some form of it. Among the main mechanisms of action by which fibromyalgia negatively influences the quality and quantity of sleep, we certainly find musculoskeletal pain. While on the one hand, it makes it difficult to find a comfortable position to sleep due to the contact between the bed and painful body parts. On the other hand, it often interrupts the sleep cycle. This leads to frequent nocturnal awakenings, which prevent the body from recovering the energy expended during the day. In the morning, you will wake up more tired than the night before, resulting in excessive daytime sleepiness, which leads to memory and concentration problems, a decrease in school or work performance, as well as headaches and mood swings. When you wake up, you may also notice some muscle and joint stiffness with a decrease in strength in your hands and arms and a feeling of swelling in your hands and feet. Following some studies, it was also discovered that fibromyalgia can be associated with alterations in the levels of some neurotransmitters of the central nervous system, such as serotonin, norepinephrine, and dopamine. Among the numerous functions they perform, we also find that of regulating the sleep-wake rhythm, whereby a reduced activity of these chemical mediators determines poor sleep quality. Lower pain threshold. Pain is a physiological reaction, a sensory and emotional experience perceived at the central nervous system level in response to potential or actual tissue damage. In people suffering from fibromyalgia, pain can differ in terms of intensity and location between different patients, but it manifests itself with two precise characteristics: hyperalgesia and allodynia. Hyperalgesia indicates a pathological increase in pain sensitivity where there is an exaggerated response to a painful stimulus. It can affect certain skin areas or manifest itself in a generalized form. Allodynia, however, unlike hyperalgesia, indicates pain caused by a stimulus, which under normal conditions would be harmless and incapable of causing any type of painful sensation. Often just lightly touching the affected part is enough to feel discomfort. What we know is that the perception of pain is very subjective and can vary significantly from person to person, as it is influenced by a series of biological, psychological, social, and cultural factors, but above all, by previous traumatic experiences. In fibromyalgia subjects, there is an abnormal perception of pain and a reduced tolerance threshold for the same. Hyperalgesia and allodynia are therefore two characteristics that are frequently found in the symptomatology of fibromyalgia. In conclusion, if you notice one or more of the symptoms described in this video, it is recommended to always contact your doctor or a specialist, generally a rheumatologist. Fibromyalgia is a complex and widely underdiagnosed condition, so much so that on average it takes 5 years from the time a patient first reports symptoms to when they formally receive an accurate medical diagnosis. Targeted and timely treatment can significantly contribute to improving the management of symptoms and therefore the quality of life of the fibromyalgia patient.
Fibromyalgia is a complex and often misunderstood chronic condition. Today we'll explore what fibromyalgia is, how it's caused, your treatment options, and more. Fibromyalgia syndrome, often abbreviated as FMS, is a long-term condition that brings about diffuse musculoskeletal pain and muscular stiffness. It is typically associated with a range of other symptoms such as sleeping troubles, intense general fatigue and heightened sensitivity to pain, mood issues like anxiety and depression, problems with memory and concentration, migraines and other types of headaches, digestive problems such as irritable bowel syndrome, bladder problems like cystitis or painful bladder syndrome, and temporomandibular joint disorders. Interestingly, fibromyalgia tends to affect more women than men and is most commonly diagnosed in the age range of 35 to 45 years. Though many people experience symptoms earlier, So what causes fibromyalgia? The exact cause remains unknown, though it's believed to have a genetic component. Overall, it's likely connected to alterations in specific chemicals in the brain, affecting how the central nervous system perceives and manages pain throughout the body. The brain's pain receptors develop a heightened sensitivity, leading them to overreact to both painful and non-painful signals. The onset of fibromyalgia symptoms is often associated with traumatic events, sometimes physical traumas like surgery or infection, and sometimes by significant psychological stressors such as mourning. However, in some cases, symptoms can gradually develop over time without a specific triggering event. Diagnosing fibromyalgia can be challenging since there is no specific test to confirm the condition. Moreover, its symptoms can overlap with other serious conditions that require different diagnostic approaches, such as multiple sclerosis, chronic fatigue syndrome, or rheumatoid arthritis. Further testing, often in the form of blood tests, can help rule out these other conditions. To be diagnosed with fibromyalgia, you need to experience diffuse pain throughout your body for at least 3 months, with pain reported in at least 4 of these 5 specific areas. The left upper region, including shoulder, arm, or jaw. The right upper region, including shoulder, arm, or jaw. The left lower region, including hip, buttock, or leg. Right lower region, including hip, buttock, or leg. And the axial region, which includes the neck, back, chest, or abdomen. Treatment options for fibromyalgia are varied, as this complex condition often requires a multidisciplinary approach. No single treatment is suitable for all patients, and specific treatments can vary in effectiveness from person to person. Therefore, it's essential to combine a variety of therapies and lifestyle changes tailored to individual needs. Treatment often includes medications like pain relievers, antidepressants, anti-epileptic drugs, and more. These medications help manage pain, boost neurotransmitter levels, and reduce specific types of pain. To boost the effects of the treatment, medications can be combined with other therapies such as osteopathy and physiotherapy. This form of treatment will help to reduce muscle tension and improve joint mobility, aiding with easing the pain around the body. Moreover, the prescription of specific exercises will improve the general posture, strength, and flexibility of the patient. Psychotherapy. Psychological support may be fundamental to help the patient to cope with their symptoms and deal with stress. The patient is helped to develop strategies for avoiding or limiting overexertion and emotional stress. Cognitive behavioral therapy, CBT, seems to be largely used to help patients with fibromyalgia. Exercise and relaxation techniques. This type of therapy is used to both help with patients' sleep and to reduce muscle tension. Water-based exercises seem to be particularly helpful. Massages. This form of therapy is used to help relax and reduce muscle tension and stiffness. Acupuncture is used to help to reduce and manage different types of chronic pain, such as fibromyalgia. Here at Body Tonic Clinic, we offer a number of fibromyalgia treatments, including massage, physiotherapy, osteopathy, and more. To cope with fibromyalgia, maintaining a healthy lifestyle is crucial. This includes eating well, avoiding smoking, limiting caffeine intake, and finding enjoyable activities to reduce stress. Fibromyalgia is a chronic disease, typically lasting a lifetime. However, it is not a progressive condition and does not cause damage to your joints, muscles, or organs. Flare-ups, where symptoms temporarily intensify, are common and often linked to stress or pressure. Fibromyalgia cannot be prevented, but proper treatment and lifestyle changes can help reduce the frequency and severity of symptoms. Reducing stress, regular exercise, consistency with therapies, and a healthy lifestyle can all contribute to minimizing the risk of flare-ups. For those living with fibromyalgia, exercise can be challenging due to pain and fatigue. Individualized exercise programs that balance activity and rest are crucial. Various types of exercises, including stretching, resistance, aerobic, low-impact yoga, and Pilates, can help manage the condition. If you suspect you have fibromyalgia, it's essential to speak with your GP. Diagnosis can be complex and your GP will rule out other conditions. They may also refer you to specialists who can help manage your condition effectively.